Chapter 23, Eye Acupuncture Therapy.
眼针疗法
Eye
是中
acupuncture,
国当
a
代
new
遗老
modality
中
of
医
acupuncture
辽
therapy,
宁中医
was
学
created
院
by Dr.
彭
Pan
敬山
Jingshan,
教授，
professor of
在汉代
Liaoning
华
College
佗
of Traditional
观
Chinese
眼识
Medicine
病学
and
术
an
思
eminent
想的基
veteran
础
of
上，
traditional Chinese
潜心
medicine
研究
in China
20多
today.
年而首创的
The
一
therapy,
种新
based on
的
the
针灸
ancient
方
medical
法。
concept of diagnosing diseases by inspecting the eyes by Hua Tuo in the Han Dynasty,
眼针疗
is the
法
result
是以
of
易
Professor
经
Peng's
的
more
阴
than 2
阳八卦
decades of
学
research
说、
in the field.
中医学的五轮八惑
Focusing
学
on the
说、
special 13
脏
points
腑经络
located
学
in
说
the
等
8
为理
defined
论根
regions
据，
or parts of the eyes.
以观察
Eye
眼球结
acupuncture is
膜、
considered
络脉、形
convenient,
色变化
painless, and
为
highly
诊病
effective.
手段。以
Its
针
theoretical
刺特
basis
定的
comes
眼
from the
周
8
八区
diagrams of
13
yin yang in the
穴
I Ching
为治病方
and
法，
from the doctrines of the Zangfu
具
meridian
有操作
and the
简
8regions
便、
of the
无
white
痛
of
和
the
有
eye
效率
in the
高
5
等特点。
orbiculi. Its diagnostic focus is on inspecting the bulbar conjunctiva.
眼针疗
Principles
法基础
of eye acupuncture therapy. The eye. The organ of vision is one of the 5 sense organs and carries out important functions in the course of
在
a
人
human
类
being's
生
life.
命过程中
In
具
the
有
Huangdi
重要作
Neijing,
用。
there are many insightful
对此，
expositions
早在《
regarding
黄
the
帝
essential
内经》
functions of
中
the
就有
eye,
精辟
such
论
as
述，
every vessel is related to the eye. The essence of the
如
5 zang and 6
诸脉
fu
皆
viscera
属于
are
物，
transported to the eye
五
to
脏
be
六
its
腑
essence.
之精气
And
皆上注
Provided
于
the
物
liver is
而
functioning
为
well and
之精。
harmoniously, it is the liver qi that
和
ascends to the
肝
eyes,
气通于
enabling them to
物，
distinguish
干
the 5
涸
colors.
则目能辨五色等。
TCM theory also holds that the eye is the window of the soul,
中医学
and that
还
the
认
look of the
为，
eye
目
reveals whether a
为
person
心
is
灵
wise or
之
foolish,
窗，
outspoken or
望
quiet-spoken,
目之神
soft or
态，能
hard-spirited,
知
and
人
whether
之
he is to have a
聪
long
愚
life
直
or a short life.
柔刚受
Therefore,
邀。
determining the quality of
从而
spirit in
对
the
某
eyes
些疾
can
病的
provide the
诊断
doctor with
能起
insights
到见
as to
微
how the
知著
disease
的
is
作用。
developing and can be used as a diagnostic medium in some diseases.
一、
Section 1.
眼与
Relation
经
of the
络的
eye
关
to the
系。
meridian.
中医经络学
Traditional
说
Chinese
认
medicine
为，
theory
眼与
holds
经络
that
的
the
关
eye
系
and the
十分
meridian
密切。
are closely related.
12经脉
The blood and
365
qi
络，
of the 12 meridians
其血
and their
气皆上注
365
于
collaterals
目而
go
走
up to
空
the
窍。
eye and the head. And the eye is the hub of all vessels. According to the meridian chapter of Ling Shu in the Huangdi Neijing, the following meridians all originate from around the eye.
胃经、
The stomach meridian of the foot Yangming, the bladder
足
meridian
少
of the
阳
foot
胆
Taiyang,
经、
and the
足
gallbladder
太
meridian
阳
of the
膀
foot
胱
Shaoyang.
经均起始于眼的周围。
The meridians terminating around the eye are the small intestine meridian of the hand
手
Taiyang,
太阳小肠经、
the Sanjiao meridian
手
of the
少
hand
阳三
Shaoyang,
焦经、
and the large
手
intestine
阳
meridian
明
of
大
the
肠经
hand Yangming.
均终止于眼的周围。
In addition,
此外
the 6
手
yin
足
meridians
六
of the
阴
hand and
经
foot
和
and
奇
the
经
8
八
extra
脉
meridians
也
are
经
directly
通过
or
络
indirectly
脉
connected
和
to the
经
eye.
别直接或间接的与眼相联系。 二、
Section
八
2,
卦的基本概念。
basic concept of Ba Gua.
八
The 8
卦
diagrams
是用
of
一
the
个
Ba
长
Gua
横
are
线
the
代
8
表
basic
阳，
figures
两个
consisting
短
of various
横线代
combinations
表
of 2
阴的
symbols,
符号重叠
yang
变
being
化
a single
而组
unbroken
成的
line
八
and
种基
yin
本
being
图
a
形。
segmented one. The
分
8
别叫
figures
做
are called
乾、
乾、
坎、
艮、
正、
巽、
巽、
离、坤、兑 in that order,
用来代表
representing the
天、
8 phenomena in
水、
nature, being
山、
heaven, water,
雷、
mountain,
风、
thunder, wind,
火、
fire,
地、
earth, and pond,
泽。
respectively,
8种
to
自然界
explain
现
how the
象
world is
和
formed
说明
and the
世界的
changes that
形
occur
成
within
与
it.
变化。八卦理
To some
论对
extent,
于后
the
世
Bagua
中医
theory
眼科五
provided a
轮八
basis
廓
for
学
eye
说的形
acupuncture
成，
by
以及
providing the
眼针
5
疗法中
orbiculi and
眼
8
周
parts
八区的
theory.
划分起到了一定的作用。三、
Section 3,
眼周学
division
区
and
的划
location
分
of
与
the
定
8
位。
parts around the eye. Referring to the doctrine of
参
the
照
8
八卦理
diagrams,
论，
we divide
确
the
定
area
眼
around
周
the
为
eye
分
into
区
8
为八
regions
个
or
部分，
parts.
划
The
分
methods
方
are as
法如
follows.
下。
In yin-yang
根据
theory,
阴
the
阳
left
学
is
说，
considered
左
yang
为
and the
阳，
right
右
yin.
为阴，所
Therefore, we
以先以
consider,
左眼定
starting
穴
from the。left
定
eye,
穴的
to
方
locate
法
the
是：
points.
眼睛向
First,
前
with the
平
eyes
视，
facing
经
forward,
瞳孔中
make a
心
cross at
做
the center
十
of the
字
pupil,
线，
passing respectively
过
the
内
inner
外
and outer
眼眦
canthus
和上下
and
眼
the upper and lower
睑，
eyelids,
成为四
thus
个
forming
象
4
限。
quadrants.
再将
Second,
4个相等
divide
区
equally
各
each
分
quadrant
成
into
2
2
个相
parts.
等部分，
In
这
this
样
way,
就
we
完
have
成了
completed
眼
the
周八
process
区的划
of
分。
dividing the left eye into 8 parts.
将眼周围划分为
Next,
8个区域
We
后，
can make
就
the
可以看
corresponding
出眼周
associations
八区
relating the
与
8
八卦
parts
图的对
around the
应
left
关
eye
系。
to the Bagua.
根据
According to
上
the
北下
Bagua,
南、
the
左
upper
西
matches
右
north,
东，即
the
可
lower
确定
south,
八
the
卦
left
在
east,
左眼周
and the
围
right
八区的
west.
对应位置。
So we have
其
Tian, situated
乾
in the
在西
northwest,
北
is the
为
first
一
part.
区，
Kan, situated due north, is the second
坎
part.
在正北
Gun,
为2
situated
区，
northeast, is the
艮
third
在
part.
东北为3区，
Zhen, situated
震
due
在
east, is the
正东
fourth
为
part.
4区，
Xun, situated
巽在
southeast,
东
is the
南为
fifth part.
5区，
Li,
离
situated
在
due
正
south, is
南
the
为
sixth
6
part.
区，
Kun, situated
坤在
southwest,
西
is
南
the
为
seventh
7
part.
区，
And Dui,
兑
situated
在
due
正
west,
西
is
为
the
8
eighth
区
part.。A mirror image of the
将左
Bagua
眼
on the
这个
left
八卦
eye
图
is what it would
向
look
右
like on
水
the
平
right eye.
翻转，即
However,
为八卦
since the
图
order
在
is
右眼
clockwise
八
on the
区的
left
排
eye,
列顺
it
序。
should be counterclockwise on the
双
right.
眼学区按
The
数字
meridian
排
points
列，
are
右
located
眼
symmetrically
为
on the
逆
left
时
and
针
right，sides.
左眼为顺时针，经络穴位左右分布对称。
Section 4. Corresponding relations of the 8 parts around the eye
4.
to the
眼周
脏腑.
八区与脏腑的配属关系。根据
We
八卦
determine the
脏腑
property
的
of
五
each
行
of the
属
8
性
parts
确定，
according to the distribution
即
of the Bagua
一区
and the property
乾
of the
属
5
金，
elements in the
对应
脏腑.
肺与大
So
肠。
therefore, the first part, Qian, matches metal,
二
corresponding to the
区
lung and large
坎属
intestine.
水，
The
对
second
应
part,
肾
Kan,
与
matches
膀
water,
胱。
corresponding to the kidney and bladder.
三区
The
艮
third
为
part,
山，
Gun,
山
symbolizes
是高
mountain,
峰，
which is high,
化为
belonging to the
上焦。
Shangjiao.
四区
fourth part,
震属木，
Zhen
对
matches
应
wood,
肝与胆。
corresponding to the liver and gallbladder.
五区
The fifth part,
巽为
Xun,
风，化
symbolizes
为
wind,
中焦。
belonging to the Zhongjiao.
六区
The sixth part,
离属
Li,
火，
matches
对
fire,
应心与小
corresponding to the
肠
heart。and small intestine.
七区
The seventh
坤
part,
属
Kun,
土，对应
matches earth,
脾与胃。
corresponding to the spleen and stomach.
八区
And the eighth
兑
part,
为泽，
Dui,
化为下
symbolizes
焦。
pond, belonging to the Xiajiao.
按照
Divided
这样
as
的划
such,
分方
in
法
part 1, 2,
，1、
4,
2、4、
6,
6、
and
7区，每
there are
区
2
2个
points for
穴
each,
为一
pertaining to a
脏一
pair of
腑。
zang and fu viscera.
3、
In
5、
part
8
3,
区，每区
5,
1
and
个
8,
穴。
There is 1 point for
各
each.
区穴位的命名
As for the
与所
nomenclature,
配属的
the
脏
points are either
腑
named
或
after
各
the
区序
corresponding
号的
zang
确
fu
定，
organs
总名
or
称
after
为
the ordinal
眼周
numbers
八
of the
区
part where the
13
point is
穴。
located. Collectively, they are called the 13 points or the 8 parts around the eye. Chapter 2. Diagnosing
2.
diseases by inspecting the
观
eye.
眼识病。
Eye inspection
观
is
眼
an
识
important
病
component
是
of eye
眼针疗
acupuncture
法的
therapy.
重要组成部分。
The vessels of the bulbar conjunctiva
正常
in a
人
healthy
眼球
person
结
are
膜的
indistinct
络
and
脉
barely
纤
visible.
细隐约
When
而
a
不
person
明
is
显。
ill, the vessels will take on
当人
various
体
changes
生
in
病
shape
后，
and in
其络
color,
脉将出
from
现
which we
各
can
种
judge the
形
sight,
色的变化
nature,。course,
据此
effect,
可以判
and
断疾
prognosis
病的
of the
部
disease.
位、性质、
It also
病
serves
程、
as a valuable
疗效
guidance
和
in the
预
selection
后，
of points for eye
并对
acupuncture.
眼针取穴有指导价值。
Some common changes
眼球结
of the
膜
shape of the
络脉
vessels of
形
the
态
bulbar
变化。
conjunctiva and their corresponding indications.
一、
Number
根部
1.
粗大，
Thick vessels with
由白
large
经
roots.
边缘处
The vessels
络
on
脉
the
粗
border
大
of the，white
逐
of the
渐
eye
向
appear
前，
thick
则
and
逐
large
渐变
and
细。
become thinner as it
此
goes
种
on.
形状多
This
属
kind
于
of
顽
vessel
固
often
性疾
indicates
病。
a chronic and persistent ailment.
二、
Number
曲
2.
张，
Cirrhosoid vessel.
络脉出
The
现
vessel
曲
is
张，
full of twists
由
and
根
turns.
部延伸，
This kind of vessel
中
reveals a
间转
disease
折
in
曲张
serious。condition.
此种形状为病史较重。 三、
Number
络
3.
脉延伸。
Stretched vessel.
按照眼周
A
八期
vessel
的划
in
分，
one part
络脉
bestrides
出
the
现
next part.
由某一
This
经
kind of
区
vessel may
传至
show
另
which
一
meridian
经
the
区的
disorder
现
comes
象
from。and what meridian it spreads over.
四、
Number 4.
分叉较
Branching
多。
vessels.
此种
This
现
occurs
象
more
多
often
出
in
现
the
在
upper
眼
part
球
of the
上
eye.
部，
It
眼
means
球
the
下
patient's
部
condition is
也有时
unstable
出
and
现，
variable.
说明病势不稳定或容易变化。
Number 5.
五、
Projection
隆起
vessel.
一条，
The vessel
结膜
remarkably
络脉
stands out.
明显隆起
as if it is on，a
好像
glass
在
plate.
玻璃板上面一样，多属
It often
于六
indicates
腑
the
病
disorders of the
变。
6 full organs.
六、
Number 6.
模
A
糊一
hazy
片，
scene.
结
The
膜
vessel is
络脉
blurred,
模糊不
often in
清。
the liver
此
gallbladder
种络
part.
脉多发生在肝胆
It
区，
suggests a case
属
of
肝
T
郁
stasis
气
with the
滞所
liver
致。
depression.
七、垂
Number
露，
7. Like dropping
白
dew.
经络脉下
In this
端
case,
像
it
垂
appears
着
as
一
if
颗颗
a
露水
dewdrop
珠
is
一
hanging
样。
down at the
若
end
见
of
于
the
胃
vessel.
肠区，多属
If it is in
虫
the
积；
stomach or intestine
见
part,
于其
it
他
often
经区
indicates，a
多
case
属
of
郁症。
enterostosis. If it is in some other part, it usually indicates melancholia.
眼
Some common
球结
changes
膜络
of the
脉
color of the
颜色
vessels
变
of the
化。
bulbar conjunctiva. Number 1.
一、
Bright
鲜
red.
红，
A
络
bright
脉
red
颜色
vessel
鲜
confirms
红
that a new
为
disease
新发
is in
病，
progress.
属于
and
湿
it is an
热，
excessive
说
heat
明病
syndrome.
势正在发展。二、
Number
深
2.
红，
Deep red.
络脉颜色
When
深
the vessel
红，
turns
多为
deep
热
red,
病，
it often
而且
indicates
提
a
示
febrile disease
病势加
and is a
重。
serious case. Number 3.
三、
Dark red.
红中带黑，
A deep red
络脉
vessel
颜色
with
深
some
红，
darkened spots
其中某
marks
段
an
杂有
interior
黑色，
transmission of
属
a
于
febrile
热病
disease.
入里。
Number
四、
4.
红
Yellowish
中
red.
带黄，
A
络脉
yellowish
颜
red
色
vessel
呈现出
implies
红
a
中带
case
黄，
that is
为
becoming
病
mild.
势减轻的现象。
5. Pale.
五、络脉
A
浅
pale
淡，
vessel is caused by
络
deficiency
脉
of
的
qi
颜
and
色
blood,
浅淡是
a
气
case
血
of
不足的
deficient
表
or
现，
cold syndrome.
属于虚症或寒症。 六、
Number
络
6.
脉暗灰
Dark，gray.
白经
A
上
dark gray
络脉
vessel
暗灰
confirms
属
the
于
focus
陈
of an
旧性
old
病
disease.
灶， 症
The
状早
symptoms
已
have
痊愈，
gone,
但
but the
络
marks
脉
on the
痕
vessels
迹
will remain
永不消
forever.
失。
Chapter 3: Clinical applications
3.
of eye acupuncture
眼针
therapy.
疗法的临床运用。
Section 1:
一、
Method of
针刺
acupuncture.
方法。
Needles. Because there are
针
abundant
具
blood vessels around the eye,
周围
hemorrhaging
血
will
管
occur
丰
if
富，
an
针
inappropriate
法不
needling
当
technique
容
is
易引
used.
起出血。所以
Therefore,
在针
thin
具
and
的
short
选择
needles
上
should be
应
selected
选
for
用
treatment.
较细较短
The
的不
most
锈
suitable
钢针
ones，are made of
以
stainless
长
steel,
15毫米、
15
直径
millimeters in length,
0.34毫
and
米的针
0.3
具最为
millimeters
合
in
适。
diameter. Insertion. One
进
hand
针
acts
时，
as
一
the
手
pressing
持
hand,
针，
and
另
the
一手
other
按
as
住
the
眼
needling
睑，
hand.
拇食指
Hold the needle
持
with the
针
thumb
迅
and
速
index
稳准
finger.
刺入，进
When
针应
inserting,
略
the
快，
motion must
可
be
以
quick,
减少疼
but
痛。
also steady
进
and
针深
precise.
度为
A
10 毫
swift
米左
insertion will
右。
cause less pain. The depth of the
眼针
insertion
进
is
针
about
后
10
不做
millimeters.
任何的提插捻
After
转手
insertion,
法，
if the
有
patient
得
has a
气
feeling
感
of
即可。
qi, no
如
extra
未得气，
manipulations
可
like
把针
lifting
提
and
出
thrusting or
1/3，
twirling
改
should be
换一
used.
个方向再刺
If
入。
there is no
也
needling
可用
sensation,
刮针柄
lift
法
the needle
以
about
促使得
1/3 of
气
the。inserted part. Change the direction of the pointed end and insert it again. For the purpose of stimulating qi, one can scrape the handle of the needle gently.
常用的眼针手法有
Commonly used
点刺
techniques
法。
are such
病
as
人闭
number
眼
1,
医生用手
tapping.
按住眼睑，
With the
在选
patient's
好
eyes
的穴
closed,
区上
the doctor
轻
uses
轻
one
点刺
hand
5到
to cover
7
the
次，
patient's
以
eyelid
不出
and
血
the
为
other
度
to。lightly tap the end of the needle 5 to 7 times at the selected point. The tapping should also be gentle so as not to
眼
cause
皮
bleeding.
横刺法，
Number 2,
针尖儿
transverse
刺入
puncturing.
后，针
After
体
puncturing
沿
into the
皮下
skin,
进入，
insert
可
the
达
needle
皮下组
horizontally
织，
into
不
the
应再
subcutaneous
深。
tissue. Do not go any deeper. Number
双刺
3,
法，
double puncturing. After
刺入
inserting
一
one
针
needle,
后，
insert
可
another
在
one
针
beside
旁
it
再按
and in
同
the same
一方
direction
向
so as
再
to
刺
strengthen
入
the
一针
effect.，
以加强疗效。表里
Number
合
4,
刺法，
go puncturing. In the same
即
point
在同
area,
一穴区
insert
内，
one needle into the
眶内、眶
intraorbital
外
and
各
another
刺一
into the
针，
lateral orbital.
临床应用效
In
果
this
更
way,
好。
a better result may be obtained.
“眶内
Number
刺
5,
法”，
intraorbital
找
puncturing.
准眶缘，
Locate
持
precisely the
针
orbital
垂直
margin
刺
and
入，
insert
针
the
尖
needle
儿偏向
perpendicularly
眶缘。
with the end of the needle towards the orbit.
“谬刺法
Number 6, contralateral
当患
puncturing.
者身体一侧
When
患
the
病，
disease side
而
does not
针刺
respond to
患侧
treatment,
穴区无
try the
效
same
时，
eye part on
可
the
以
healthy
在
side.
对侧眼周围同名穴位区针刺。
Number
眶
7,
内埋针法，
intraorbital implantation.
对
For
疗
a
效不
patient
巩
who does
固的
not
病
consistently
人，
respond to
可在
treatment,
应刺的
an
眼穴
intradermal
区
needle
刺入
on the
皮
relevant
内
points
针，
around the eye may
以
be
胶
embedded
布
for
埋
1 to
藏
2
固定
days,
留
immobilized
置
with
1
adhesive
到2
plaster.
日。电针法
Number 8, electric acupuncture.
眼针刺入后，
After the
为加
insertion,
强疗
an
效，
electrical
可在
stimulator
针
may be
柄上
connected through the handle
连
of the
接
needle
电疗机
with
导
very low
线，
level current.
通以微量电流治疗。 压血
Number
法，
9. Point pressing.
用火柴
Use a
棒
matchstick
或
or
三
the
棱
handle
针
of a
针
3-edged
柄
needle
在眶
to
内
press the
眼
eye
穴
point for
区
treatment.
按压进行治疗。眼针
Number
与
10.
体针配合，
Combination method.
眼
Eye
针可以
acupuncture
单
may
独
be
使
used
用
alone，
也可
or
以配合
in
其他
combination
的
with
针
other
法和药
acupuncture
物治
techniques
疗
or。medicine. Duration of needle retaining.
留针
The
时
retaining
间，
period should not be too
眼针
long,
留针时间不宜过
approximately
长，
5 to 15
以
minutes.
5到15分钟为宜。
When
起
withdrawing,
针，
hold the handle of the
起
needle
针时
with the
用
two
右手
fingers
二
of
指
the right
依住
hand
针柄活
and
动
move
几
the
下，
handle several
缓缓
times
拔出
before
1/2
withdrawing it
一，
halfway.
少停几秒，再慢慢的
Halt the
提出
withdrawal，for a few
即
seconds
用
and
干
then
棉
withdraw the
球压
rest
迫，
of the inserted
以防
needle
止出
gently.
血。如果
Swiftly
一旦出
press
血，
the
应
punctured
延长
site
压
with
迫
a
时
dry
间。
cotton ball
次
so as
日
to，prevent
如果
bleeding.
出现皮下淤
If
血
bleeding
者
does，occur,
可用热毛
the
巾
pressing
外
time
敷，
shall be
一
longer
般
than
2到
usual.
3天即可
If
下
there is
退。
subcutaneous blood stasis the next day, a hot compress may be used. Generally speaking, it will disappear in 3 days.
禁忌症
Contraindication.
对于身
For those
体
who
震
tend to
颤
be
不止
trembling,、
躁动不
restless,
安、
or whose
眼睑
eyelids
肥
are
厚
thicker
者
than average,
可不用眼
eye
针。
acupuncture should not be applied.
2.
Section
取
2.
穴原则。
Principle of point selection.
循
Number
经
1.
取穴。
Selection of the corresponding meridian points.
循经取穴也
This
叫
is
辨
also
证
called
取
the
穴，
selection of
即
points
诊断病症属
according
于
to
哪一经
syndrome
或脏
differentiation.
腑，
For
汲
example,
取哪一
for
脏
disorders
腑或
pertaining to a
穴
given
区。
meridian or a given viscera, and for
比如
points or
肾
the
虚
related
腰痛
visceral
病
part
人
around
应
the eye
取
that
属
are
于
needled.
肾膀胱的
For
第二
instance,
区。
For lumbago due to kidney deficiency, the second part belonging to the kidney and bladder should be selected.
看眼取穴，
Number 2.
即
Selection
无
of the
论
points
病
on the
属
basis
何
of eye
区，
inspection.
看眼球
Select the
络
part
脉变
where
化
there is
哪
the
个穴
most
区最
notable
明
change
显
of the，vessel
就
of the
应取
eyeball,
哪个穴
no
区。
matter where the disease corresponds. 3.
病位取
Selection
穴
of the point according to the
是
disease part.
按上
If the
中
disease
下
site
三
is
焦
located in
划
the
分
area
病
above
位
the
界
diaphragm,
限，
the 上焦
即
part should
病
be
位
selected.
在膈肌以上者取上焦区，病位在
If the
膈以
disease
下
site is in the
腰
area
以上
between the
者
diaphragm
取
and the
中焦
loin,
区。
the 中焦 part should be selected.
病位在
If
腰
the
以
disease
下
site
者
is in the
取
area
下
below
焦
the
区。
loin, the 下焦 part should be selected. Section 3.
常
Treatment
见
of
病的
commonly
眼针
encountered
治疗
diseases。with eye acupuncture.
“这是一位中风
Number
偏
1.
瘫的病人，
Hemiplegia.
患者左侧半身不
In this
遂，
case,
生
a
活不
hemiplegic
能自
patient,
理，由陪
unable to
护
live on
搀
his
扶
own,
进入诊
walked
室。
into the clinic under support. The left half of his body
脉
was
弦
paralyzed
细，
after apoplexy. His pulse was stringy and thready.
患侧上肢呈痉挛性瘫
The
痪，
left hand suffered from
手指
spastic
不能
paralysis
伸展。
and the fingers of which he could not stretch.
舌红少
His tongue was
开。
red with a scanty coating.
观眼肾区
Eye
络脉
inspection
粗
showed the
大
vessels
怒
in the
张
kidney part
呈紫
were
红
thick,
色，
large,
上下交
varicose,
络脉
and
呈
purplish
鲜
red in
红
color.
色。
The vessels of the shang and xia jiao parts were bright red. Before the treatment, the patient could not lift his upper limb by
针
himself.
前患侧上肢不能主动抬举，下肢略能抬
He
动
could move his，left
但不
lower
能
limb a
持续
little
抬举。
once in a while, but not consistently.
健侧上下
On
肢
his right
主
side,
动抬举
the
活动
hand
正
and leg
常。
could move as normal.
按病
Based
位
on the
取
disease
穴，
site, we
针
selected
刺
the
双
xia
侧
and
下
shang
焦
jiao
和
parts
上焦
on
区
both。sides.
“针后即刻重
Upon
复针前
examination
检
following
查
the。treatment, the patient showed that he could
患
raise
侧
his
下
leg by
肢主
himself
动抬
about
高
50
50厘
centimeters,
米，
compared with 70 centimeters by his right leg.
健侧抬高70厘米。 上肢也能
The
明
upper
显抬
movement
高
of。his left hand was also noticeably improved.
针后5分钟，患者
5
下
minutes after
床
the treatment,
能自
the
己在
patient was
诊
able to
室
get off
缓
the
慢
bed by
步
himself
行。
and walk slowly about in the clinic.
“这是一
Number
位
two,
急性腰部扭
Acute
伤的病
lumbar
人，
sprain.
患者腰
Suffering
痛
from
剧
severe
烈，
lumbago,
步行艰
the
难，
patient had
由
great
家属
difficulty in
扶进
walking by
诊室。
himself, and he had to be supported by his relatives when he walked into the clinic. His pulse was stringy and tense.
脉弦紧，舌无苔，
His tongue coating was white.
观眼可
Eye
见
examination
下焦
revealed
区
that
络
the
脉变
vessels of the
粗，
xiajiao
呈
part
鲜红色
became，thicker
为急性
and were
病
bright
变。
red in color. This was an acute case.
按病位取
We
穴，
selected the points according
用
to the
眶
disease
内
site
刺法
and
针
needled his
刺
bilateral
双
xiajiao
下焦
parts
区。
intraorbitally.
然后
After
令患
treatment,
者站立，
we let the
慢慢
patient
地
stand
活
up
动腰
and
部。
slowly move his loin.
患者感觉
By
腰
then,
部轻
the
松，
patient
疼
was feeling
痛
less
缓
tension
解。
in the loin, and the pain alleviated.
这是一位
Number
胆石
three,
症胆绞痛急性发作的患者，
Having an acute
患者
attack
右
of
侧腹
biliary
部疼
colic,
痛剧烈难
the
忍，
patient is suffering from unbearably severe pain in the right loin.
脉弦
His
紧，
pulse was stringy and tense.
舌苔白，
His tongue coating was white.
观眼可
Eye
见
inspection
肝胆
revealed
区
bright red
络
and
脉
thick
鲜
vessels
红
in the
粗
liver
大，
gallbladder
并向
part.
中焦区延伸。
The vessels stretch right to the 中焦 part.
按观眼取穴
We，selected
在
points
右侧
according
肝
to
胆
eye
区针刺
inspection
一针
and。inserted a needle on his right liver gallbladder part.
患者立刻
The
感到
patient
疼
felt
痛
an
减
immediate
轻，逐
alleviation from
渐
the
缓
pain,
解。
which continued to gradually subside.
这是一
Number
位
four,
患肩周炎的病人
Periarthritis，of the shoulders.
脉细无力，
The patient had pain in the
舌淡无
shoulders
苔。
with limited movement of the upper limb as a result of periarthritis.
肩部疼痛，上肢活动受限。观眼上焦区
Her
络脉
pulse was
变
thready and
粗，
spiritless,
呈淡
and her
红
tongue
色。
coating was white. Eye inspection showed vessels in the shangjiao part had become thicker and light red in color.
按观眼取
Based
穴，
on eye inspection,
针刺
we
双上
selected
焦
the
区
points and
配
needled her
双肺
bilateral
大
shangjiao
肠
parts
区。
in combination with the lung large intestine parts on both sides.
针后，
After the
患
treatment,
者肩
the
部
patient
疼
felt the
痛
pain
减
alleviated.
轻，
She could also raise her hand and touch her head.
可做摸头的动作。上肢活动
The
范围
range of
增
movement
大，
in her
疼
upper
痛
arm
缓解。
was greatly extended.
这是一位左侧落枕的
Number
患者
5,
左侧颈部疼痛，主动活动困难。
This patient suffered from a stiff neck on his left side.
在被动活动时，颈部疼痛加重。
And when it was moved passively, it caused him severe pain.
观眼左侧
Eye
肺
inspection
大肠
showed the
区和
vessels
上
in the
焦
lung,
区
large
络脉鲜
intestine
红
and the 上焦
为
parts
病变
on the
初
left
期。
side were bright red, indicating the disorder was in the early stages.
针刺患侧上
Right
焦
after the
区
needle
一
was
针，
inserted into the 上焦 part of the eye of the diseased site, the patient felt his neck relax immediately.
颈部即刻感觉轻松，疼痛逐渐缓解。
The pain gradually alleviated. Number 6, hypertension.
这是一位高压221
This
毫米
patient
汞柱、
suffers from
低压
hypertension
125毫米
with
汞柱
blood
的
pressure
高
of
血压患者。
221 over 125 millimeters per mercury.
按辩证取穴
We，selected the point
针刺
according to
双
the
侧
syndrome
肝胆
differentiation
区。
and needled his bilateral liver gallbladder parts.
立刻再测量血
We
压，
examined his blood pressure right after treatment.
高压197毫米汞柱，
197 over 121 millimeters per
低压
mercury.
121毫米汞柱。高压和
It
低压
decreased
均较
both
针前
in
有所降
systolic
低，
and
心
diastolic
率
pressure.
也有所减慢。
His heartbeat slowed down as well.
这是一位右侧
Number
下
7,
牙疼的
a
患者，
toothache.
诊脉
This
沉
patient
紧，
had an ache in her lower right teeth. Her pulse was deep and tense.
舌苔薄黄，
The tongue coating was thin and yellow in color.
观眼可见
Eye
肺大
inspection
肠区
showed the vessels
络
in the
脉
lung
深
large
红
intestine
有
part
分叉
were。deep red with some branches.
针刺
We
右侧
needled
肺
her
大
right
肠
lung large
区
intestine part
上焦
and
区
the
后，
上焦part.
牙痛即刻
The
缓解
toothache。was eased at once.
这是一
Number
位
8,
慢性胃脘
chronic
痛的病
gastralgia
人，
The
脉
patient
沉
was suffering
细，
from chronic gastralgia. The pulse was deep and thready.
观
Eye
眼
inspection
可
revealed
见
vessels
中焦
in the 中焦
和脾
and
胃
the
区
spleen stomach
络
parts
脉怒
were
张，
deep
颜
red
色
in
深
color.
红。
Selecting the
按病位
points of the
取双
disease
侧
site,
中焦
we
区
punctured her
针刺。
bilateral 中焦 parts. But there was not much relief with regard to her gastralgia.
针后胃痛无明显缓解。再捻
After
针，
twirling the needle and scraping the handle of the needle,
刮
The
针
patient
柄
had the
以
feeling
促
of 得
进
气
患者得气
and the
后
pain was
胃
alleviated.
痛缓解。
Clinical practice shows that the
根据
major
临
effects of
床
eye
报道，
acupuncture are
眼针主要
resuscitation,
有
clearing and
醒
activating
神开
meridians,
窍、通
regulating the
经
flow
活
of vital
络、
energy,
理气止
reducing
痛
pain,
和增
and
强组
strengthening
织
the
器官
vitality of
活力
organic
的功
tissues.
能。
So far,
目
there have
前
been over
眼
40
针疗
types of
法
clinical
临床适
indications
应症
which can
已
be
达
treated with
40
eye
余种。
acupuncture therapy. With the
随着
growth of
眼针疗
education
法
and
的传
application of
播
eye
和应
acupuncture
用，
therapy,
其适
the
应症
extent of
还在不
indications
断
of
扩
this
大，
therapy are also
必将
expanding,
为人类
and
的
it will make
健
greater
康做出
contributions to
更
the
大
health
的
of
贡献。
humankind.